Hello all, welcome back to our channel Zen Spine English, where we discuss about common spinal problems and help you understand what is the right treatment for you. So today we are going to talk about cervical myelopathy. If you look at the word cervical, that refers to the neck region, and myelopathy, if you look at this word, myelo refers to the spinal cord and pathy refers to pathology or any problems related to the spinal cord. So cervical myelopathy refers to any spinal cord problems or any spinal cord related pathology in the cervical spine. Now the most common cause of cervical myelopathy is degenerative, meaning wear and tear. As you age, the spine also ages, and that causes wear and tear of the spine, which leads to compression of the spinal cord, and hence it is called compressive cervical myelopathy. Now, if we discuss what are the symptoms of this problem, these patients usually have neck pain with or without radicular arm pain, and disturbance in performing fine motor activities like buttoning, unbuttoning their shirts, handwriting changes, their signature changes, they drop objects from their hands, they are not able to use fork and knife, their balance might also deteriorate, they might be able to walk for a few minutes and then they lose balance, they might fall, they might also have disturbance of bowel and bladder control at the end stages or advanced stages of this problem. If we talk about diagnosis of this problem, this is typically diagnosed on an MRI scan where we are able to look at the spinal cord, how much is the compression, how many levels are compressed, and if we talk about the severity of the compression, we are able to compare the various sequences of the MRI scan and see if the color of the spinal cord has also changed. Now the significance of this is if the spinal cord turns white due to compression, then these patients are going to take longer time to recover, or their recovery might not be as what we expect otherwise. Now, to give you a simple analogy of that, if you tie a tight rubber band or a tight thread on my finger, the color of this is going to change. It may be like a little grayish, bluish, and it will be compressed. So the longer it is and the tighter it is, after you remove the band, it will still be compressed. The color will be different than the rest of the finger. So that is how the color of the spinal cord is also different when it is compressed for a longer duration. That will also determine how much is the recovery after surgery. So talking about treatment for this condition, the treatment is surgery. There is no other thing that you can expect recovery in such patients with. Like for medications, yes, you can use medications to control the symptoms, but that is not going to cure the disease. It is a simple mechanical thing that you should understand. If a thing is compressed, if you take medicines, it's going to take care of your pain for some time, but unless you remove the compression, that cord is not going to be free. So it is very essential that these patients undergo surgery and the compression on the spinal cord is removed. Now talking about the treatment, you have to understand why is surgery done. There are two important objectives for which the surgery is done. The first objective is to prevent further deterioration. To prevent worsening is the first objective why surgery is done. Meaning whatever your condition is now, we have to preserve that and prevent you from worsening, and hence surgery is done. That is the first objective. The second objective is to expect some recovery after the surgery. It is not going to be the next day recovery. It is going to take few weeks, months, maybe a year, depending on the severity of your compression. So please do not expect that if you undergo a surgery, you will be all right on the day 2 and you'll be able to start walking. That is not the case in such patients. It takes longer duration depending on what stage the treatment was offered. I hope this video helped you to understand what the cervical myelopathy condition is, what are the symptoms, how it is diagnosed, and what are the treatment options. If you still have any doubts, please do not hesitate to write in the comment section below, and we'll do our best to reply to those comments and help you with your queries. Thank you so much.